Yeah, there's so many different specialists out there, and there's just so much information now that I think there's no way that, one person can manage it all. So, we'll refer out if there is a specialist that a patient needs to see as well. One thing you said that was particularly interesting was improving the lymphatic drainage. So that's something I believe has been shown to be less effective as you increase in age and maybe pathologic and development of cognitive impairment and Alzheimer's, that you're not flushing out things of the brain as well. So
Mhm.
there's just so many moving parts here. You've got your antioxidant status, blood flow, your drainage system. And I believe there's some studies that show you actually, building, as you mentioned, new blood vessels during the hyperbaric therapy.
Yes.
So you kind of have two groups of people, I guess, that are looking for this. I guess you could say three: the acute, the chronic, and then people who don't necessarily have a chronic issue, but they're like,
Mhm.
how can this benefit me?
Mhm.
So off the top of my head, I could think, athletes,
Sure.
connective tissue, it tends to have a poor blood supply. So improving the blood supply there makes sense that that would be of benefit. But for people that are using this more recreationally or in the biohacking sphere of things, what
Mhm.
kind of benefits can they expect? And, what are some of those things that they can do to optimize what they're getting out of the hyperbaric therapy?
Yeah. So what it comes down to is the things I just described, right? We're reversing low oxygen, we're decreasing inflammation, we're getting stem cells released, we're killing bugs, and we are improving flow. So my sense of it is that anybody can really benefit from that. The question is not if hyperbaric therapy will be helpful, it's kind of when, as far as I'm concerned, and how can you can best utilize it depending on what is going on with you otherwise. And so if people that are healthy are looking to use hyperbaric therapy, I usually will recommend some sort of optimal kind of framework, looking at laboratory analysis, comprehensive kinds of things, because that's going to be sustainable for them over the long term if they can look at deficiencies and toxicities and imbalances and things like that. That's ideal for me. So if somebody comes to me, hey, Dr. Scott, I just want to use this to perform better. Well, then I go, perform better doing what is the first question, right? To perform better athletically, perform better cognitively, perform better in the bedroom. What are you looking for here, right? And then I can kind of dial in the protocols. And I think what's important to also delineate is that there are acute hyperbaric therapy protocols. These are protocols that you do for an acute condition, and there are protocols that are done for more long-term goals, and they're different in a number of different ways. But the most important way is the number of treatments that we're talking about. So typically in a hyperbaric environment, for an acute condition, we're looking just to stimulate and to enhance the healing process. And that usually means that you're in the chamber between 3 to 10 times. And these are chamber treatments that are usually done after after the acute issue happens. Sometimes they're done before, though. For example, if you have a known surgery coming up and you want to pre-oxygenate your tissue, there's some data that says that using hyperbaric therapy before you get the surgery can help prepare your tissue for the surgery itself, and you will heal faster. So you do a couple treatments before and you do 3 to 5 treatments afterwards, and your healing time on average can be about 50% faster if you're relatively well optimized. If you're not as well optimized, it might be a little bit on the lower end of that spectrum. But I can't tell you how many times I've had people come in after their surgical follow-up. They've had their surgery, they did hyperbaric therapy before, they did it afterwards, and the surgical follow-up, and the doctors are just amazed at how fast that they're healing. This could be anything from a knee surgery, like a knee replacement, arthroscopic surgery, whatever, or it could even be something as vain as a plastic surgery, and you don't want to have raccoon eyes for 2 weeks, you want to have it for 1 week instead. And you can see hyperbaric therapy have a significant benefit, and not doing that many sessions. We're talking about 3 to 5 sessions, maybe 2 before, maybe 3 afterwards. And you can see a significant difference in that healing process for the reasons I mentioned before: the decreased inflammation and swelling, getting more oxygen to tissue, et cetera, more flow. And for the longer term protocols, though, when you have a longer term condition where you're looking to really shift that epigenetics in a way that helps optimize from that foundational level, then you're looking at treatment protocols that are anywhere between 20 to 40, sometimes 60 or 80 sessions in the hyperbaric environment. These sessions are usually done Monday through Friday with weekends off for that period of time. Now, there are exceptions, though. Like if you're doing this from a recovery perspective, say you're just looking to optimize muscle recovery from a workout, one-off sessions, I would call that more of an acute issue, right? You have an acute muscle trauma because you've just exercised, and now you want to recover from that exercise. You get into a hyperbaric environment once after your hard workout, you're going to recover faster and better the next day. For example, for me, I had a hard workout yesterday. I went into my chamber, and my deep sleep, my recovery was off the charts because I went into the chamber afterwards. And so this is something that I'll do with my athletes as well, is that I'll have them time their hyperbaric sessions in a way that optimizes recovery and optimizes for what they need. So I have smaller protocols for things like jet lag and injury recovery that's mild, like mild aches and pains. But the key for me, though, James, is that if somebody's looking for like longer term benefits of a hyperbaric protocol, not just the acute muscle recovery, even the acute injury recovery, then the idea really is we want to shift those epigenetics. We want to shift that expression and suppression of various genes on the DNA so that you have better oxygen utilization over the long term, and you have a healing environment overall because you've shifted those epigenetics. And so that usually for me is like what I would call a startup protocol. Like you start up and use hyperbaric therapy for 20 sessions, ideally for me. And depending on the indication, also depends on the type of pressure, which I'll talk about in a minute. But what you want to try to do is get that shift over about 20 sessions. And then after that, you can use it periodically depending on what your needs are, because now you've shifted those epigenetics. You're now in a place where you can benefit even more using hyperbaric therapy in a targeted, intermittent sort of way. But the last piece of this to discuss is that there's different types of chambers out there, right? There's chambers that you can get for your house. Like I have one at my house that goes to what's called 1.3 atmospheres. That's about 12 feet of seawater equivalent. And you have chambers that go to very deep pressures, medical grade chambers that go to 3 atmospheres. That's typically the deepest unless you're in a hospital. And 3 atmospheres is the equivalent of about 66 feet of seawater. Most of the medical indications of hyperbaric therapy are between 1.3 and 2.0. But there are deeper ones in the acute setting when you want to go to 2.4. Even some of the longer term indications like chronic Lyme disease or inflammatory bowel disease or even acute injuries, you sometimes go to 2.4 atmospheres. So in general, the therapeutic window is between 1.3 and 2.4 for most things. But from the neurologic side of things, you're getting your sweet spot in your brain is somewhere between 1.3 and 2.0. And then systemically, you're talking about 2.0 to 2.4 mostly. And so within that range, depending on your conditions and your goals, it depends on what kind of chamber that would be most appropriate for you. So for most people that are looking for longevity, biohacking, optimal performance, the mild units tend to do a good job because you can also start adding in other types of technologies that you do before, during, and after to kind of leverage the technology, leverage the hyperbaric environment, and then use it to achieve your goals. In other people, it's better to go to deeper pressures depending on their conditions and their goals as well.
Yeah, that's great to know that some of these home units is not just people, throwing their money away, that there's still some benefit to be had by those when it's done in combination with other things for overall optimization. So the striking thing I think you mentioned is that you have to have a very large volume or a higher volume than one would anticipate in terms of when you're going to see the benefits. So chronically anyway, for like long-term health optimization. So maybe somebody, like you mentioned, a short jet lag protocol, maybe that's a one-off scenario where it makes sense. But if somebody is like, oh, well, I'll just do, a couple of these sessions per year, and that's going to, protect and optimize my health. It's just a much larger volume of sessions you need to get that effect. And I think that's what's been shown in some of the data coming out of Israel, where they're doing a lot of these studies, like the telomere lengthening that everybody got very excited about. I believe that was a large number of sessions as well.
Yes.
So, a lot of exciting research going on. Is there anything that you're watching in particular right now that is either recruiting or undergoing that you're excited to see the results come out?
You mentioned a good place to look, which is the Israeli group. It's called, what is it called? They're calling some of the Aviv centers now. That's their for-profit arm. The facility in Israel is at a place called the Asaf Harafeh Hospital in Tel Aviv. And they've been around now doing studies, putting out since about 2013. And they have the largest hyperbaric facility in the world. They're doing about 200 to 250 people per day in their hyperbaric environments. And the one thing I didn't mention about the chambers, there's different types of chambers. There's a chamber that's for single occupancy, so one person. And there's chambers that are called multi-place chambers, which are for multiple people at the same time. And the Israelis and a lot of other places around the world that have diving locations, because one of the indications that I forgot to mention for hyperbaric therapy, which is the primary, and the initial indication was for the bends or decompression illness. And so divers, there's usually hyperbaric facilities in those locations. Those have to go to very deep pressures, even deeper than 3 ATA. But so they have a multi-place chamber in Israel. They have actually 4 of them. And so they have 12 people within these 4 chambers that are diving every 2 hours, basically throughout the day. And so what's interesting about the multi-place is that everybody has to dive to the same pressure, and everybody gets oxygen through a mask in their that they're wearing. So the nice thing about a monoplace sometimes, or a single occupancy chamber, is that you can navigate the pressures a little bit more nuanced in a way that you can start at a different pressure and not everybody has to be at the same pressure. So that's the major benefit of being in the monoplace. What's also nice of being in the multiplace, this can dovetail to your question, is that inside of a hyperbaric environment, you are obviously hyperoxygenated. Your multitasking ability goes up. Your ability to potentially heal from injuries and doing various tasks to stimulate that healing inside the hyperbaric environment is possibly increased and better. And so there is one study on multitasking performance. They're doing some other work where they're doing physical therapy inside of a hyperbaric environment and doing other types of performance related metrics like VO2 max testing as well, of course, is going to go up in a hyperbaric environment. But to see how this works in the sense of long term, after being in a hyperbaric chamber, do you have these benefits to a larger extent because you were doing these kinds of maneuvers inside of a hyperbaric environment? And in addition, there was the work on telomeres was extremely interesting, and also the work on senescent cells. And senescent cells are these cells that accumulate as we get older, and they're also known as zombie cells. And basically what that means is that they don't divide anymore. They don't work very well. They just cause inflammation. And they're also associated with cancer, degeneration, et cetera. So there seems to be a downregulation or a decrease in the number of senescent cells inside of the hyperbaric chamber. And we don't know what's happening. We don't know if they're just, so what we want a cell to do is when the cell understands that it's no longer functioning well, what it's supposed to do is release signals to make itself die, to apoptose. And so we're not sure if the cells are just getting signals to die, to apoptose, or if they're regenerating themselves under hyperbaric conditions. It's unclear. But either way, there's going to be more research that's going to come out on the senescent cell side of things, which actually excites me more than the telomere side of things, because the senescent cells, we know for sure that they have a direct correlation. But telomere lengthening is a bit tricky because we also know that telomere length is associated with younger chromosomes, but there's also some cancers that will turn off telomere length shortening so that they can continue to divide over a longer period of time, the cells that they're making. So, I mean, there's no indication that hyperbaric therapy has any pro-cancer growth activity at all, but it's just something that to keep in mind, that I think the senescent cells are the more interesting side of things. There's also a lot of new work that's happening in the post-COVID world, in the long COVID patient population, and we're seeing a lot of great benefits of using hyperbaric therapy in that context as well.
Yeah, that the senescent cells are particularly interesting. I would speculate it could be a bit of both. If you're getting stem cell activation, that's going to be regenerative in itself. And then more reactive oxygen species are going to take those more susceptible cells that need to undergo apoptosis. And, maybe that's occurring. And again, just speculating, but I would think there would be some anti-cancer potential to hyperbaric therapy. If it's going to generate more reactive oxygen species, we know that cancer cells are more sensitive to that damage. That's why things like radiation and chemo, which induce massive cell damage, wipe out preferentially those cancer therapies. So lots of exciting stuff on the horizon there. And yeah, with the telomeres, I think you're totally right. It's not as simple as how long are your telomeres? Did we reverse age? What I'm looking at in terms of like anti-aging, if you will, for that term, is looking at the tissue function, right? So how well is that tissue function? How well is your cognitive performance? How well is your exercise performance? Are you seeing improvements there? Then we're making it as if you function at a younger age again, not necessarily that we're dialing you back from 40 to 30, but we're seeing those sorts of objective improvements, things that we can measure, like arterial stiffening is a great example of that. So in terms of, almost anybody can use hyperbaric oxygen, but are there any people in particular who it would be contraindicated for, or they would have to get certain conditions under better control before they would use hyperbaric oxygen therapy?
Yeah, that's always a good question to touch on. It's important that people know that hyperbaric therapy is it's a condition, or it's a procedure, a technology that does require a prescription. Okay. And the reason for that is there are certain people that shouldn't get into a hyperbaric environment. And the the only absolute contraindication, the only absolute reason you can't get into a chamber is if you have something called a tension pneumothorax. And a tension pneumothorax is not something that most people are going to have. It's basically when you have a lot of air that fills up your chest wall cavity and compresses your lung and you can't breathe. So if you can't breathe, don't go into a hyperbaric chamber, go to the hospital, kind of thing, right? But on the other side of things, from a pulmonary condition perspective, if you require oxygen at baseline, then it may not be a great idea to get into a hyperbaric chamber, because we're going to be giving you extra oxygen in the chamber. And if you have a difficult time balancing your CO2 and O2 balance, that could be a challenge. So in people that are oxygen dependent, not usually appropriate to go into a hyperbaric environment unless it's an acute indication in a hospital.